Read and follow the accompanying instructions for use before you start using Inbrija, and each time you get a refill, as there may be new information. Remember, the instructions for use and this video don't take the place of talking to your healthcare provider about your medical condition or treatment. Hi, I'm Peter, and I'm here to show you how to use Inbrija. Please know that using Inbrija may take some practice at first. Here are the parts to your Inbrija inhaler. Before we continue, here's some important information to keep in mind. Never swallow Inbrija capsules. Inbrija capsules should only be used with the Inbrija inhaler and inhaled through your mouth. Let's get started. Let's prepare your dose. Find a clean, dry surface and make sure your hands are clean and dry too. Then get your Inbrija inhaler and a strip of capsules. Tear off a package of 2 capsules. Always check the expiration date. Then, remove the blue cap on the inhaler by pulling it straight off. Twist and pull off the mouthpiece to separate it from the handle. Carefully peel back the foil and take out 1 capsule. Remove only 1 capsule at a time and do that just before you're ready to use it. Never use any capsule that looks crushed, damaged, or wet. If it does, throw it away and get a new one. Load the capsule by holding the inhaler upright using the handle. Drop 1 capsule into the opening of the capsule chamber. Do not try to load 2 capsules at the same time. Reattach the white mouthpiece by lining up the white arrows on the handle and mouthpiece. Firmly push the mouthpiece and handle together until you hear a click. Only do this once because this punctures the capsule. If you push the handle and mouthpiece together more than once, you could damage the capsule, and you may not get your full dose. If you push down more than once, throw the capsule in the trash and start over with a new capsule. When you release the mouthpiece, it will spring back and stay attached. Your inhaler is now ready to use. Hold the inhaler level and away from your mouth. Stand or sit up straight and look straight ahead. Breathe out. Do not breathe into the mouthpiece. While keeping the inhaler level, close your lips firmly around the mouthpiece. Breathe in slowly and gently, just enough to hear or feel the capsule whirl as it spins inside the inhaler. The whirl means the inhaler is working and you are getting your medicine. Then take the inhaler out of your mouth and hold your breath for a few seconds. Then breathe out. It is quite common to cough when you breathe in, but try not to. If you cough out the medicine, it will reduce the amount you receive in your body. For some people, coughing may feel like the sensation of choking. Just remember, you don't need to breathe in strongly. You may take more than 1 breath per capsule if it's easier for you. Some people have found that sipping liquid before and after breathing in the medicine also helps with cough. Please see the important safety information at the end of this video. If you didn't hear or feel the whirl, take deeper, longer breaths until you do. If you still don't hear or feel the whirl, try cleaning the mouthpiece before moving on. We'll touch more on cleaning the inhaler later. Twist and pull off the mouthpiece, and take out the used capsule. As you are throwing the capsule away, you will notice that there are 2 puncture marks on the top of it. You may also see powder residue. This is normal. Repeat these steps with the second capsule. Carefully peel back the foil and take it out. Load the capsule by holding the inhaler upright using the handle. line up the white arrows and push the mouthpiece and handle together until you hear a click. Standing or sitting up straight, hold the inhaler level and away from your mouth. Breathe out. Keeping the inhaler level, close your lips firmly around the mouthpiece and breathe in slowly and gently as you did with the first capsule. You will hear and feel the capsule whirl. Hold your breath for a few seconds. Then breathe out. Twist and pull off the mouthpiece and remove the used capsule. You're ready to dispose of the used capsules and store your inhaler. Throw the used capsules in the trash. To avoid powder buildup, you can clean your inhaler as needed. Start by removing the white mouthpiece. You will see that there are holes on both sides of the mouthpiece. Use a new, dry cotton swab to wipe the powder off the holes from both sides of the mouthpiece using a circular motion. You can also use a dry tissue to wipe the outside of the mouthpiece. Do not clean any other parts of the inhaler. Do not rinse the mouthpiece or get the inhaler wet. Always keep the inhaler and capsules dry. Replace the mouthpiece and cap, aligning the white arrows. Never store a capsule inside the inhaler for a future dose. Always keep the inhaler and capsules dry. It's important to note that once you've used all the capsules in a carton, throw out the inhaler. For your next dose, open a new carton. Each one has a new inhaler and capsules. And that's how to use Inbrija. Thanks for watching, and please refer back to this video and the instructions for use included with each refill anytime you need a refresher. If you have any problems using Inbrija, contact Inbrija support at 1-888-887-3447.
Inbrija, levodopa inhalation powder, is a prescription medicine used when needed for OFF episodes in adults with Parkinson's treated with regular carbidopa-levodopa medicine. Inbrija does not replace regular carbidopa-levodopa medicine. Important safety information. Do not use Inbrija if you take or have taken a non-selective monoamine oxidase inhibitor, such as phenelzine or tranylcypromine, within the last 2 weeks. Before using Inbrija, tell your healthcare provider about your medical conditions, including asthma, chronic obstructive pulmonary disease, COPD, or any chronic lung disease, daytime sleepiness, sleep disorders, sleepiness or drowsiness without warning, or use of medicine that increases sleepiness, including antidepressants or antipsychotics, dizziness, nausea, sweating, or fainting when standing up, abnormal movement, dyskinesia, mental health problems such as hallucinations or psychosis, uncontrollable urges like gambling, sexual urges, spending money, or binge eating, glaucoma, pregnancy or plans to become pregnant. It is unknown if Inbrija will harm an unborn baby. Breastfeeding or plans to breastfeed. Levodopa can pass into breast milk, and it is unknown if it can harm the baby. Tell your healthcare provider if you take MAOB inhibitors, dopamine D2 antagonists, including phenothiazines, butyrophenones, risperidone, metoclopramide, isoniazid, iron salts or multivitamins that contain iron salts. Do not drive, operate machinery, or do other activities until you know how Inbrija affects you. Sleepiness and falling asleep suddenly can happen as late as a year after treatment is started. Tell your healthcare provider if you experience the following side effects: falling asleep during normal daily activities with or without warning. If you become drowsy, do not drive or do activities where you need to be alert. Chances of falling asleep during normal activities increases if you take medicines that cause sleepiness. Withdrawal emergent hyperpyrexia and confusion, fever, stiff muscles, or changes in breathing and heartbeat. If you suddenly stop using Inbrija or carbidopa-levodopa, or suddenly lower your dose of carbidopa-levodopa. Low blood pressure when standing up, that may be with dizziness, fainting, nausea, and sweating. Get up slowly after sitting or lying down. Hallucinations and other psychosis. Inbrija may cause or worsen seeing, hearing, or believing things that are not real, confusion, disorientation, or disorganized thinking, trouble sleeping, dreaming a lot, being overly suspicious or feeling people want to harm you, acting aggressive and feeling agitated or restless, unusual uncontrollable urges such as gambling, binge eating, shopping, and sexual urges has occurred in some people using medicine like Inbrija. Uncontrolled sudden body movements, dyskinesia, may be caused or worsened by Inbrija. Inbrija may need to be stopped or other Parkinson's medicines may need to be changed. Bronchospasm. People with asthma, COPD, or other lung diseases may wheeze or have difficulty breathing after inhaling Inbrija. If this occurs, stop taking Inbrija and seek immediate medical attention. Increased eye pressure in patients with glaucoma. Your healthcare provider should monitor this. Changes in certain lab values, including liver tests. The most common side effects of Inbrija are cough, upper respiratory tract infection, nausea, and change in the color of saliva or spit. Do not orally inhale more than 1 dose, 2 capsules, for any off period. Do not take more than 5 doses, 10 capsules, in a day. Please see accompanying patient information leaflet.